Are you tired of the constant battle against autoimmune diseases? If so, we have great news for you. Alemtuzumab is causing ripples in the medical world and revolutionizing the way autoimmune diseases are treated. This comprehensive guide will take you through everything you need to know about this groundbreaking medication. Understanding autoimmune diseases. Autoimmune diseases are a group of disorders where the immune system mistakenly attacks the body's own healthy cells and tissues. These conditions can affect various organs and systems, leading to chronic inflammation and a range of symptoms. Some common autoimmune diseases include multiple sclerosis, MS, rheumatoid arthritis, RA, and lupus. In autoimmune diseases like MS, the immune system targets the protective covering of nerve fibers, disrupting the transmission of signals between the brain and the rest of the body. This results in a wide range of symptoms, including fatigue, muscle weakness, and problems with coordination and balance. How alemtuzumab works in treating autoimmune diseases. Alemtuzumab is a monoclonal antibody that targets and depletes specific types of white blood cells, including T and B lymphocytes, which play a central role in the immune response. By effectively resetting the immune system, alemtuzumab helps to reduce the autoimmune response and control the progression of the disease. The medication works by binding to a protein called CD52, which is found on the surface of these white blood cells. Once bound, alemtuzumab triggers a series of immune responses that ultimately lead to the destruction of these cells. By selectively eliminating the malfunctioning immune cells, alemtuzumab helps to restore balance to the immune system, reducing the severity and frequency of autoimmune attacks. Common autoimmune diseases treated with alemtuzumab. Alemtuzumab has shown promising results in the treatment of various autoimmune diseases. One of the most well-known conditions treated with this medication is multiple sclerosis, MS. In clinical trials, alemtuzumab has been shown to significantly reduce relapse rates and slow down the progression of disability in patients with relapsing remitting MS. Rheumatoid arthritis, RA, is another autoimmune disease that can benefit from alemtuzumab treatment. RA is characterized by chronic inflammation in the joints, leading to pain, stiffness, and progressive joint damage. Alemtuzumab has been shown to effectively suppress the immune response responsible for joint inflammation, providing relief and improving the overall quality of life for RA patients. Lupus, a systemic autoimmune disease that can affect multiple organs, is another condition that can be treated with alemtuzumab. By modulating the immune response, alemtuzumab helps to reduce inflammation and prevent organ damage in lupus patients. Although further research is needed, early studies have shown promising results in controlling disease activity and improving patient outcomes. Benefits and risks of using alemtuzumab medication. Alemtuzumab offers several benefits for patients with autoimmune diseases. Firstly, its unique mechanism of action allows for selective targeting of specific immune cells, minimizing the impact on the overall immune system. This targeted approach helps to reduce the risk of opportunistic infections and other complications associated with broad immunosuppression. Another benefit of alemtuzumab is its long-lasting effect. After receiving the medication, most patients experience a prolonged period of disease control, reducing the need for frequent treatments or medication adjustments. This can significantly improve the quality of life for individuals living with chronic autoimmune diseases. However, like any medication, alemtuzumab also carries some risks. One of the main concerns is the potential for infusion-related reactions, which can include fever, chills, nausea, and rash. These reactions are more common during the initial treatment and can usually be managed with premedication and close monitoring. Additionally, alemtuzumab can increase the risk of developing secondary autoimmune diseases, such as thyroid disorders or immune thrombocytopenic purpura. Regular monitoring and proactive management of these potential complications are essential to ensure patient safety and well-being. Dosage and administration of alemtuzumab. The dosage and administration of alemtuzumab can vary depending on the specific autoimmune disease being treated. In general, the medication is administered intravenously over several days in treatment cycles. The exact dosing schedule and duration of treatment will be determined by the treating physician based on the individual patient's needs and response to therapy. During the initial treatment cycle, patients typically receive a higher dose of alemtuzumab, followed by a lower maintenance dose in subsequent cycles. Close monitoring is crucial during and after treatment to assess the patient's response, manage potential side effects, and adjust the treatment plan if necessary. It's important to note that alemtuzumab should only be administered under the supervision of a qualified healthcare professional experienced in the use of this medication. Patients should follow their healthcare provider's instructions and attend regular follow-up appointments to ensure optimal treatment outcomes. Potential side effects of Alemtuzumab. While Alemtuzumab can be highly effective in treating autoimmune diseases, it can also cause side effects. The most common side effects include infusion-related reactions, such as fever, chills, and rash, which typically occur within the first few days of treatment. These reactions can usually be managed with premedication and close monitoring. Alemtuzumab can also increase the risk of infections, including respiratory and urinary tract infections. Patients receiving this medication should be vigilant for any signs of infection, such as fever, cough, or urinary symptoms, and report them to their healthcare provider promptly. Another potential side effect of Alemtuzumab is the development of secondary autoimmune diseases. Regular monitoring of blood counts, thyroid function, and other relevant parameters is necessary to detect and manage these potential complications. Less common but more serious side effects include severe infusion reactions, immune-mediated complications, and malignancies. These risks and potential side effects should be thoroughly discussed with the treating healthcare provider before starting Alemtuzumab treatment. Frequently asked questions about Alemtuzumab. How long does it take to see the effects of Alemtuzumab? The effects of Alemtuzumab can vary depending on the individual patient and the specific autoimmune disease being treated. Some patients may experience a noticeable improvement in symptoms within a few weeks, while others may require longer periods of treatment before seeing significant changes. Can Alemtuzumab cure autoimmune diseases? While Alemtuzumab can effectively control disease activity and reduce symptoms, it is not considered a cure for autoimmune diseases. The goal of treatment is to manage the condition, slow down its progression, and improve the patient's quality of life. Can Alemtuzumab be used in combination with other medications? In some cases, Alemtuzumab may be used in combination with other medications, such as corticosteroids or disease-modifying antirheumatic drugs, DMARDs. The decision to combine therapies will depend on the specific autoimmune disease being treated and the individual patient's needs. Success stories and patient experiences with Alemtuzumab. Patient experiences with Alemtuzumab can vary, but many individuals have reported significant improvements in their quality of life after starting treatment. Success stories range from increased mobility and reduced fatigue in MS patients to remission of joint inflammation and pain in RA patients. It's important to remember that each patient's journey with Alemtuzumab will be unique, and individual responses to the medication can vary. However, these success stories provide hope and inspiration for others living with autoimmune diseases. Conclusion: the future of Alemtuzumab in autoimmune disease treatment. Alemtuzumab is a revolutionary medication that offers new hope for patients struggling with autoimmune diseases. Its targeted approach to immune system modulation has shown great promise in controlling disease activity and improving quality of life. While Alemtuzumab is not without risks, its benefits outweigh the potential side effects for many patients. With ongoing research and advancements in treatment protocols, the future of Alemtuzumab in autoimmune disease treatment looks promising. Don't let autoimmune diseases dictate your life. Educate yourself, make informed decisions, and join the revolution in treating these conditions. Alemtuzumab may be the key to a healthier, balanced life. Speak with your healthcare provider to determine if this medication is right for you. Remember, you are not alone in this journey. Together, we can conquer autoimmune diseases and pave the way for a brighter future. Thanks for watching.